Hello, I'm Dr. Sonia Davison. I'm an endocrinologist and women's health expert. I'm delighted to be with you as part of the endota wellbeing conversation. I've worked in women's health since 2001. It's been an absolute pleasure to work with women. I did a PhD looking at 1,423 Australian women's hormones and their relationship with age, menopause, brain function and sexual function. It's an absolute pleasure to look at women's hormones, to care for their health and help them age gracefully and naturally and safely. In this conversation, we explore what endocrine disruptors are, how they interact with the body's hormonal system, and the everyday ways we may be exposed to them. We'll also discuss simple ways to reduce exposure and create more hormone-supportive routines and environments. Hormones are very delicate, tiny little chemicals that make a message happen somewhere else, and endocrine disruptors can interrupt the impact of those hormones. They can alter the production and the metabolism, and they can also alter the function of the hormones. Well, endocrine disruptors are chemicals, essentially, and they're chemicals that we've made by putting products and things into this environment as people. We can find endocrine disruptors all around us, unfortunately, in very, very small quantities. In the air, in the water, in packaging, in plastics, in products around us, in skincare products. We just really don't know the limit. This is very much an emerging field as well, where we're recognising the impact of these chemicals on our bodies. It's really tricky to try and see what the actual endocrine disrupting chemicals are doing versus other things in this world and within our bodies. But we think from looking at big populations and exposure to these chemicals that they can affect hormones and they can affect things like fertility and reproduction. And in some circumstances, they have been linked to cancer and altering our metabolism. Practical steps that people can take to avoid the influence of endocrine disruptors include avoiding plastic packaging, avoiding bottled water, for example. I'm not saying don't have it, but just be very aware of it. Avoiding non-stick cookware is one example. Some toys have plastics in them, and some cosmetics and personal care products also have chemicals in them, and they might be labelled as fragrance, they might be labelled with very specific letters, but just having a little bit more awareness is the first step. When choosing skincare products to minimise exposure, just be very aware of a few different words. There are the parabens, they're the phthalates, they're very hard to spell that word, and there are numbers and letters that have been used. Things like DEP, DBP, DINP, and DHP are things that are chemicals that we probably should try and avoid. Also the plastics and packaging with PVC, that's been thought to lead to endocrine disruption as well. Another thing to consider is those that are labelled with fragrance, because that has also been found to be an endocrine disruptor in some cases. It's very difficult to live in a very complex world. Women are very busy and so are men, and we can't be aware of absolutely everything. But it's important to just think of what's important to you and your health. For example, if you're looking at fertility, reproduction, metabolism, and you're worried about cancer risk, just be aware of your environment, aware of the products that we're using, and just do a little bit of research. It's important to remember our hormonal systems are really adaptable because the body was designed to deal with stress and to deal with external sources. So we're quite resilient, and it's only when those external stressors get very, very extreme that the body can't really deal with them, or if we get very unwell. This really isn't about eliminating everything. It's about knowledge, it's about informed choices, and trying to reduce exposure where it's realistic. So if you know what's in different products and if you know what you're using around the home, trying to minimise exposure, but we can't all be perfect. We can't avoid exposure to this world, just trying to keep it as safe as we can with the knowledge that we have. In terms of clinical data we have for these compounds and chemicals, We really don't know the whole story, but we do know from clusters of cancers, for example, and women with fertility issues, that they have been linked to exposure to various of these chemicals. So this is an emerging area. We need more research, and we also need to take care of ourselves and try and use more natural products and try and avoid processed foods and chemicals if we can. Understanding how the body works helps us care for it more intentionally. To learn more from the Endota Wellbeing conversation and explore simple ways to support your health and longevity, visit endota.com.